Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. Downloadable slides and resources are also available. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
The following presentation is part of a certified educational activity provided by Medscape Education and developed and funded by Medscape.
Hello, I'm Dr. Caroline DuPont. I'm a board-certified psychiatrist and addiction medicine doctor. I'm also the vice president of the Institute for Behavior and Health. I hope you've had the opportunity to watch Understanding Nicotine Use and Addiction, Nicotine Prevention. This educational activity will focus on advocating for nicotine-free youth and a healthy community. Before we dive headfirst into our topic, I think it's helpful to start with a brief look at the reason that we're advocating for nicotine-free youth. That reason is addiction. The National Institutes on Drug Abuse describe addiction as characterized by compulsive drug seeking and use, even in the face of negative health consequences. For the purposes of clarity, I'm going to be using addiction and substance use disorder interchangeably in this presentation. Nicotine is one of the many substances that can lead to substance use disorders, but it's also one of the most common substances used by youth. Substance use disorders are often thought of as adult problems. However, we should understand that substance use disorders are pediatric onset. The vast majority of adults with a substance use disorder started using before the age of 18, and many way before that time. 90% of adults with a substance use disorder initiated substance use before the age of 18. Nicotine, like other substances, superstimulates the brain reward system by releasing dopamine in quantities much higher than for normal activities necessary for our survival, like food and sex. Even occasional smoking by youth increases the risk of lifelong dependence tenfold. Nicotine use by youth interferes with or hijacks this important stage of brain development and sets the stage for substance use disorders. If substance use is initiated before the age of 18, there's a 25% chance of developing addiction. If that initiation is pushed back to after the age of 21, that risk drops to about 4%. Keep in mind that the most common substances used by young people are nicotine, alcohol, and marijuana. These MRI images show the changes in brain development during childhood and adolescence. We see earlier maturation in the areas related to motor, sensation, emotions, and motivation. The prefrontal cortex, which is home to our executive functioning, is one of the very last areas of the brain to develop. The processes going on during this critical time of development are what makes the adolescent brain so vulnerable to substance use exposure. First, we have neural pruning, where the neural connections that are no longer needed, they're not used, are pruned away. And second, those connections that remain are reinforced, becoming efficient circuits for processing information quickly and effectively. That process is through myelination. Think of this as hardwiring key neural pathways. Simply put, the neural pathways that fire together wire together. And substance use behaviors, those that are superstimulating the brain reward system, can be hardwired into the developing brain with early exposure. This is the biological basis of why delaying exposure to these substances is so critical. Research has been clear that there are both genetic and environmental factors in the onset of nicotine and other substance use. We know adolescents are more likely to smoke if their parents smoke. But nicotine use, like other substance use, is often introduced in social settings among peers. Substance use typically spreads from an experienced user to a novice. Teens choose friends who use substances in a similar way, and they influence one another over time, becoming more alike in their substance use. Encouragingly, social influence can be positive as well and normative of non use. The degree to which an adolescent's peers use alcohol or illicit drugs is one of the strongest, if not the single strongest, predictor of that adolescent's own substance use. Nicotine products have changed dramatically over time. They fall into two main categories of tobacco derived and non tobacco derived. The traditional tobacco derived products are less commonly used by youth today due to decades of public health efforts. So, here are some examples that we're all familiar with, like cigarettes and cigars and smokeless tobacco. But that's not so much what our young people are using today. They are using our non tobacco derived products, particularly e cigarettes or vapes. Those are the most commonly used delivery devices of nicotine by youth. Nicotine pouches are now increasingly popular, and underage consumers are using them more than ever. Most of these products are marketed with colorful packaging and sweet flavors, making them attractive to youth. And youth are also attracted by how easy they are to hide from adults. A brief note that when young people initiate substance use with these products, they may not even know what it contains. Many e cigarettes or vape products contain nicotine, but some contain THC, the psychoactive ingredient found in cannabis. But young users may not actually realize that they contain any drugs at all. Nationally in the US, 4.5 million young people ages 12 to 20 were current users of nicotine in 2024. This is over 11% of young underage population. 4 million vaped nicotine, while 1.2 million smoked cigarettes. Notably, youth who vape are 3 to 4 times more likely to go on to smoke products than their peers who don't vape. Given what we know about the developing brain and substance use, the age of first use is something we need to consider. Over 5.4 million people in the US ages 12 or older initiated nicotine vaping in 2024. And over 1/3 of this group, more than 1.8 million, were under the age of 21 at the time of initiation. Looking at the other substances, nearly 2/3 of cigarette initiates in the last year were under the age of 21 at first use. And just over half of marijuana initiates were under 21, and over 70% of alcohol initiates were under the age of 21. The top reasons people report vaping nicotine is to relax and relieve tension. At that moment, nicotine may in fact provide relief. But we know when a person is dependent on nicotine, which can happen very quickly, withdrawal symptoms are unpleasant and can actually cause the exact problems that they were trying to prevent. And so this can effectively encourage young people to keep using to avoid the unwanted symptoms they were trying to treat in the beginning. Many of us are concerned about the increase in mental health problems in young people. A recent study analyzed 2022-2023 survey results from over 15,000 high school students across the state of Massachusetts and found that nicotine, as well as alcohol and cannabis, were each independently associated with increased prevalence of significant mental health challenges, depression, anxiety, psychotic experiences, and ADHD symptoms. The kids think that these drugs, including nicotine, will help them with their symptoms, but in fact, they can make them worse. One of the reasons I keep bringing up alcohol and cannabis in relation to nicotine is that research shows that for youth, all substance use is closely related. A study from the Institute for Behavior and Health analyzed data from the National Survey on Drug Use and Health and used nationally representative sample of 17,000 youth ages 12 to 17. Controlling for age, sex, race, and ethnicity, researchers showed that when a young person uses any one substance, nicotine, alcohol, or cannabis, they had a significantly increased risk of using the other two substances and other illicit drugs. An updated analysis of this data for youth ages 12 to 17 in 2022 National Survey on Drug Use and Health confirmed that connection between tobacco use or nicotine vaping and other substances. Youth who used a tobacco product or vaped nicotine in the last month were significantly more likely to use alcohol, engage in binge or heavy alcohol use, to use marijuana and other illicit drugs than their peers that did not use tobacco or vape nicotine. In other words, it's unusual for young people to use only one substance. If they use one, they are very likely to use others. On the encouraging side, this also shows that young people who don't use a substance like nicotine are also unlikely to use other substances. I think of this graph as little bars, big bars. If a young person does not report any nicotine use in the past month, little bars, they're very unlikely to be using other substances. If they do report past month nicotine use, big bars, they are at increased risk for using all other substances, including the ones that the adults are most frightened of. So when you think about your clinical work with young patients, I encourage you to think outside the bounds of individual substances, including nicotine. If your patient endorses one substance, consider their use and risk of use of other substances. Nationally, youth substance use has declined significantly over the past 50 years. This graph shows past month substance use among high school seniors reported in the nationally representative Monitoring the Future study. We see significant declines across the board in alcohol use, cigarette use, and the use of illicit drugs. Cannabis use declined until the 1990s. It's remained pretty stable over the past 20 years. Cigarette smoking by high school seniors was down to a record low of 9.7% in 2017. And that's when nicotine vaping was introduced. You can see that the new delivery device that was supposedly marketed to adult smokers to help them stop smoking caused a dramatic uptick in youth nicotine use, with a peak of nicotine vaping of 2019 with 25.5% of high school seniors, from 9.7 in 2017 to 25.5 in just a few years. Vaping of THC is likely going to contribute to sustained prevalence of cannabis use as well, so we'll have to see how that goes. I show this graph for us to think about the impacts of public health policies. Increasing the national legal age of alcohol to 21, the master tobacco settlement that funded the Truth Campaign, and increasing the legal age of nicotine use to 21. As healthcare providers, we all have a role to play in supporting nicotine-free and substance-free youth to support long-term health. This is the same data, focusing only on the cigarette use and vaping of nicotine. The use of e-cigarettes reversed that long-term decline in U.S. tobacco use and expanded the tobacco epidemic by attracting many adolescents at low risk of initiating substance use. You might think that subsequent decline in vaping since 2019 peak is good news, and of course in some ways it is, but research study by Glantz et al., published in 2022 in JAMA Network Open, showed that between 2014 and 2021, although the prevalence of e-cigarette use among adolescents peaked in 2019 and then declined, the age of initiation of first-ever users continued to decrease. The intensity of use and level of addiction among adolescents who are current e-cigarette users increased. The intensely potent nicotine products that are available today underscore the clinical need to address youth nicotine use and to promote not using any nicotine products by youth. Now I'm going to share some great news. All of that was a little sad, so we're going to talk about something that's really positive. A growing percentage of American youth are not using any substances. This is the Monitoring the Future data on 12th graders from 1976 to 2023. No use of any alcohol, nicotine, marijuana, or other illicit drugs. Beginning in 2015, that even included non-use of vaping of any products like nicotine, or even flavoring. So let's start by looking at that blue line at the bottom. This is the percentage of 12th graders reporting no use of any alcohol, cigarettes, marijuana, or other illicit drugs in their lifetime. Again, high school seniors who haven't used any substances in their lifetime. In 1983, less than 3% of high school seniors had never used any substance. Now, that's over 35%. That's a sustained long-term trend that many people find surprising. I also am really excited by that purple line above. This is 12th graders who report no use of any substance in the past month. In 1983, only 16% of high school seniors hadn't used any substance in the past month. And now it's 60%. Most teens, in this case high school seniors, are not using substances. When we factor in vaping with this most recent data, the numbers come down a little bit, but not a lot. Because for teens, all substance use and non use is related. So people who were being counted now for vaping were in fact already being counted for other substances they use. In youth, substance use is almost all polysubstance use. But also, non use of one substance protects you from the use of others. So the people who were not using any other substances didn't start vaping. How can you help promote nicotine-free use in your practice in your community? Start with a clearly stated prevention goal. The goal of youth substance use prevention is no use of any alcohol, nicotine, cannabis, or THC, or other drugs by youth under the age of 21 for reasons of health. I know that's a mouthful, but it's important to be really clear and to articulate what we mean. Some people are tempted to say it's important to be drug-free, and I love that idea of being drug-free, but does that include nicotine? Does that include alcohol? We need to be really clear about what we're talking about. This is a health standard like other health standards that we should feel confident as medical providers in promoting. We promote wearing seatbelts, wearing helmets, eating healthy foods, exercising. We know not everybody does those things all the time. But that doesn't change the health standard, and it doesn't change our message. When we know better, we do better. Seatbelts didn't used to exist in cars. Bicycle helmets are even newer. Thinking about brain protection in sports, we now have concussion protocols. Those didn't exist when I was a kid. As our understanding increases, our health policies improve. The American Academy of Pediatrics makes it clear for youth non-use of nicotine and other substances is the health standard. The non-use message should be reinforced by pediatricians through clear and consistent information presented to patients, parents, and other family members. And I'm going to broaden this message to include all healthcare providers, nurses, doctors, pharmacists, anybody that works with youth around health has an opportunity to talk to youth, their families, their caregivers, educators about this information. The National Council on Mental Well-Being found that youth trust healthcare providers for accurate information about substance use, but they're actually not very comfortable speaking with them about it. They are more comfortable speaking with friends and peers and parents and caregivers. So that gives us two directives. First, we need to be the ones to start the conversations with our young patients. And second, we need to educate the families, the teachers, and the other caregivers, arming them with accurate information. Remember, you are a trusted source of health information, both inside your office and beyond it. Framing the way we talk about substance use with youth matters. Research conducted by the National Council on Mental Well-Being showed that the top two ways of framing substance use conversations that resonated most with youth were a focus on the future and risk of addiction. Those are topics that they understood and they were interested in discussing when it comes to addiction. But the other three frames that also resonate well are relationships, activities, and self-affirmation. These can be really helpful when you're starting those difficult conversations. When a young person is already using nicotine, simply saying you should stop is clearly not enough. You're going to need to use your honed motivational interviewing skills to help them plan for this experience and the difficulty of withdrawal. Helping young patients think through the supports that they have, enlisting people and helping them make these difficult behavioral changes It's going to pay off in the long run. Also, youth are interested in understanding the vulnerability of the developing brain, the connection between mental health and substance use, and the reality that big business is making money at the cost of young people's long term health. These are all ways that you can connect with youth and help them with the decisions that they need to make. Remember, using and non using is an active choice, and we need to give our youth the tools to make that decision. Both the Academy of Pediatrics and the Substance Use and Mental Health Services Administration recommend using screening, brief intervention, and referral to treatment, or SBIRT, as part of routine health care. There are several easy-to-use, validated screening tools available. For example, the latest version of Kraft now does screen for nicotine, and that's really important because screening for nicotine is recommended at every clinical encounter with young people. And screening is also an opportunity to reinforce non-use. Don't miss that opportunity. So that's a vote for screening tools, but I also want to remind us that brief conversations with any youth we come in contact with is an opportunity for us to have these conversations. The more times we talk about it, the more information we can get across. Let's focus on areas of advocacy for a minute. The American Academy of Pediatrics has a toolkit on tobacco control advocacy. AAP created this guide because nicotine products are dangerous to the health of all children at every single stage of development. So these are some of the topics that you might want to become involved with in your own community, like banning flavored nicotine products, banning indoor use of nicotine and cannabis, fighting preemptive laws for nicotine regulation, implementing and enforcing Tobacco 21 laws, and discussing the toll of e-waste on our environment. The emergence of nicotine vaping is a global health issue. The World Health Organization estimates nearly 1 in 5 adults use tobacco and nicotine products. Over 100 million people worldwide use vapes, and 15 million are between the ages of 13 and 15. The WHO director of the Health Determinants Promotion and Prevention Department was explicit at the release of the latest WHO report, saying e-cigarettes are fueling a new wave of nicotine addiction. They are marketing as harm reduction, but in reality are hooking kids on nicotine earlier and at risk of undermining decades of progress. So the question is, how can you help promote nicotine-free youth in your practice and community? Start with a clear non-use goal that is rooted in health. Use validated screening tools for nicotine and other substances, and know the resources available for those brief interventions. Have conversations with young people, families in your communities to push back against the assumption that all teens are using nicotine and other substances. Non-use is the norm. Let's get that information out there. You can advocate for policies that promote youth health. Join a community coalition, see if your community has a place for safe disposal of vaping devices, such as pharmacies, police departments, or schools. If there isn't one, could you start one? Help the communities think through keeping nicotine and other substances out of the hands of youth and children, away from pets and animals too, and we need to maintain a healthy environment for everybody. Here are some resources for screening, information, and advocacy. I hope you have renewed confidence in advocating for nicotine-free youth and a healthy community. Remember, as a healthcare provider, you are a trusted source of accurate information and someone who is seen as a leader in your community. Thank you for your hard work in protecting our children. All healthcare providers belong at the prevention table. For example, a school nurse could use an extra minute during a routine health visit to talk about nicotine use or cessation. A pharmacist could put up a poster with information on nicotine prevention in youth, and also let the people know that they are available for consultations. And a physician can use the screening process to reinforce the message of non-use and to encourage healthy choices for their patients, including non-use of nicotine.